Steady state is the concentration at which the rate of drug administration becomes equal to the rate of drug elimination. At this point, the amount of drug entering the body is exactly balanced by the amount of drug being removed, so the plasma concentration remains constant over time. First and most importantly, the time required to reach steady state depends only on the elimination half-life of the drug. It does not depend on how large the dose is or how frequently you give the drug. However, for a drug to reach steady state, there is an important prerequisite. The drug must follow first-order elimination. As we discussed earlier, in first-order kinetics, the rate of drug elimination is directly proportional to the drug concentration in the plasma. This simply means that when the drug concentration is high, the body removes the drug faster, and when the concentration is low, the elimination becomes slower. Now, when we administer a drug repeatedly at fixed time intervals, the drug concentration does not reach steady state immediately. Instead, the drug gradually accumulates in the body over several half-lives. Let us understand this concept clearly by using a graph. On the x-axis, we plot time in hours, and on the y-axis, we plot plasma drug concentration. Suppose we give the first dose of 100 micrograms per milliliter. Immediately after administration, the plasma concentration becomes 100. Now, assume the half-life of the drug is 4 hours. Therefore, after one half-life, that is after 4 hours, 50% of the drug is eliminated, and the concentration falls from 100 to 50 micrograms. At this exact time point, we give the second dose of 100 micrograms. Since 50 units from the first dose are still present, the new plasma concentration now becomes 150 micrograms. As we discussed that when the concentration increases, the rate of elimination also increases. But the half-life remains constant because this drug follows first-order kinetics. Moving forward, after another 4 hours, again 50% of 150 micrograms is eliminated, so the concentration falls to 75. At this point, we administer the third dose of 100, raising the level to 175. After the next half-life, it falls to around 88. Then we add another dose, and the concentration rises further. This process keeps repeating, but gradually you will notice that the rise and fall in drug levels becomes stable. Eventually, a point is reached where the amount of drug eliminated become almost equals to the amount of drug administered, and this is what we call steady state concentration. From the graph, it becomes very clear that it takes about 1, 2, 3, 4, 5, so about 4 to 5 half-lives to reach this steady state.